Good morning. So today's my topic is neurinoma of the cauda equina. Neurinoma of the cauda equina, which is also known as spinal tumor, is a growth that develops within your spinal canal or within the bones of your spine. A spine cord tumor, which is also called as intradural tumor, is a spinal tumor that begins within the spinal cord or the covering of the spinal cord, and that is dura. A tumor that affects the bone of the spine, that is vertebrae, is called vertebral tumor. Spinal cord tumor may be classified as one of the three different types depending on where they occur relative to the protective membrane of the spinal cord. Spinal tumor or the growth of any kind can lead to pain, neurological problem, and sometimes paralysis. A spinal tumor can be life-threatening and cause permanent disability. So in the beside figure, we can see spinal tumor, how it occurs between the in the space. These are the main types of intradural tumor. First, we have intramedullary tumor, and then we have extramedullary tumor. Intramedullary tumor begins in the cell within the spinal cord itself, such as gluteus, astrocytomas, or ependymosis. Extramedullary tumor grows in either the membrane surrounding the spinal cord or the nerve roots that reach out from the spinal cord. Although they don't begin within the spinal cord itself, this type of tumor may affect spinal cord function by causing spinal cord compression and other problems. The examples of the examples of extramedullary tumor that affect spinal cord include meningiomas, neurofibromas, schwannomas, and nerve sheath tumor. Tumor from other parts of body can spread, metastasize to the vertebrae, the supporting network around the is spinal cord, or in rare cases, the spinal cord itself. Spinal tumor or growth of any kind can lead to pain, neurological problem, and sometimes paralysis. Clinic. Spinal cord tumor can cause different signs and symptoms, especially as the tumor grows. The tumor may affect your spinal cord or nerve root, blood vessel, or bones of your spine. The signs and symptoms may include pain at the site of the tumor due to tumor growth, back pain, often radiating to the other parts of body, feeling less sensitive to pain, heat, and cold, loss of bowel and the bladder function, difficulty walking, sometimes leading to fall, back pain that worsens at night, loss of sensation or muscle weakness, especially in your arms or legs, muscle weakness which may be mild or severe in different part of your body. Back pain is a common early symptom of spinal tumor. Pain may also spread beyond your back to your hips, legs, feet, or arms and may worsen over time even with treatment. The causes. It's not clear why tumor develops. Experts suspect that a defective genes play a role, but it's usually not known whether the genetic defects are inherited or simply develop over time. They might be caused by something in the environment, such as exposure to certain chemicals. In some cases, however, spinal cord tumors are linked to known inherited syndromes such as neurofibromatosis 2 and von Hippel-Lindau disease. Risk. Spinal cord tumors are most common in people who have neurofibromatosis 2. This inherited disorder, benign tumor develops on or near the nerve related to hearing. This may lead to progressive hearing loss in one or both ears. Some people with neurofibromatosis also develop spinal cord tumor. The second, people who are having this is von Hippel-Lindau disease. This rare multisystem disorder is associated with blood vessel tumor in the brain, retina, and the spinal cord, and with other types of tumor in the kidney or the adrenal gland. In diagnosis, if your doctor suspects a spinal tumor, the test which are used for diagnosis are spinal magnetic resonance imaging, that is MRI. MRI uses a powerful magnetic field and radio waves to produce accurate images of your spine, spinal cord, and nerves. MRI is usually preferred test to diagnose tumor of spinal cord and surrounding tissue. A contrast agent that helps highlight certain tissues and structures may be injected in your vein, in your hand or forearm during the test. The second method we have is CT scan, that is computerized tomography. This test uses a narrow beam of radiation to produce detailed image of your spine. Sometimes it's combined with an injected contrast dye to make abnormal changes in the spinal canal or the spinal cord easier to see. The CT scan is the only rarely used to help diagnose spinal tumor. The third diagnostic method we have is biopsy. The only way to determine the exact type of spinal tumor is to examine a small tissue sample, that is biopsy, under a microscope. The biopsy result will help determine treatment option. In the beside figure, we can see the MRI scan of spinal cord. In the between the figure, we can see the tumor, which is shown by the arrow. Treatment. The goal of the spinal tumor treatment is to eliminate the tumor completely, but this goal may be complicated by the risk of permanent damage to the spinal cord and the surrounding nerves. The treatment options are: first is monitoring. Some spinal tumors may be discovered before they cause symptoms, often when you are being evaluated for another condition. If small tumors aren't growing or pressing on surrounding tissue, watch them carefully before all that is needed. Then second is surgery. This is often the treatment of choice for tumors that can be removed with acceptable risk of spinal cord or nerve injury damage. Newer technology and instruments allow neurosurgeons to reach tumors that were once considered inaccessible. The high-powered microscopes used in microsurgery make it easier to distinguish tumors from healthy tissue. But even in the latest technology advances surgery, not all tumor can be removed. When tumor can't be removed completely, surgery be followed by radiation therapy or chemotherapy, or both of them. Then we have radiation therapy. This may be used to eliminate remnants of tumor that remain after the surgery, to treat inoperable tumor or to treat those tumor where surgery is too risky. The next we are having is chemotherapy. The standard treatment for many types of cancer. Chemotherapy uses medications to destroy cancer cells or stop them from growing. Your doctor can determine whether the chemotherapy might be beneficial for you, either alone or in combination with radiation therapy. The next therapy we are having is by medication. Because surgery and radiation therapy, as well as tumor themselves, can cause inflammation inside the spinal cord. Sometimes doctors prescribe the drugs like corticosteroids to reduce the swelling, either after surgery or during radiation treatment. Thank you.